the Affordable Health Care Act. Um, and so they don't know, they think it's two different things. And so just the smallest things like that to exactly what's going to happen, that people have to have insurance and by the beginning of 2014, the penalties that can be assessed to people who don't have it, a lot of how to go about getting health care. Um, do you have to buy it from your company? Can you buy it on the market? People are not understanding. We have had numerous people go around to block clubs, the neighborhood organizations to try to explain it and put it into layman's terms. The council president, as well as myself, says, we need to do something to educate the constituents. Something as the common council, who has which this level of government pretty much has its hands on with the community. Every street, everybody knows their council member. And so we need to educate, and the educated consumer is our best customer. Yeah. And so we want to make sure that people know. And so today we have assembled a number of professionals, and as I like to call them experts in the business, to try to explain the Affordable Health Care Act, try to put it in as layman's terms as possible, because it can be very complicated for a lot of people. And also we will have this airing on Channel 22, the public access channel. So we have the cameras here, so that this can continue to go on, and people can tune in and listen to the discussion that's had here today. And so I would like to introduce our council president, Richard Fontana.
Good evening, everybody. Thank you. And for those watching at home, thank you for watching. This is an important night because we do want to get information out to the public. Whether you hear from Republicans or Democrats, it's all coming down the pike, and we really need to know what's going to be happening. So with us today, and Melanie is here. Melanie, can you pronounce your last name? Stang? I didn't want to say it wrong. I was going to say Stange, make you Italian, but I didn't do that to you. But Melanie is our External Affairs Outreach and Marketing Project Coordinator for New York State Department of Health, or just New York State of Health, essentially. So we want to make sure we get that correctly. And you do have a presentation to give us on the monitor today, so we're going to have that very shortly. I want to also introduce the panelists tonight. Pamela Powensky. Pamela is from Univera Healthcare, and Pamela is here tonight. Roberta Rifkin from Independent Health. Roberta, welcome. Our good friend Don Ingalls, Vice President over at Blue Cross and Blue Shield. Don, thank you for coming. We really appreciate you being here. And a good friend of mine, Ms. Simone R. Washington from Kaleida, is here as well. Simone and I have worked together for many years at the George K. Arthur Center on Genesee Street. So Simone, good to see you in one of those seats. And depending on what district you're living in, if it's not Massillon or Lovejoy, hopefully you could run. And then also our moderator tonight will be Jim Anderson. Jim is here, and we want to thank Jim for moderating. So with that, I'm going to turn it back over to the Majority Leader, Mr. Smith, to start off the presentation.
All right. And so what we're going to do is we're going to have a presentation by the New York State Department of Health. And they're going to try to explain exactly how this whole affordable health care is going to go. Then after that, we're going to have Jim Anderson, and Jim Anderson is no stranger to health care, and actually trying to get people to be interested and to educate on health care. And so we have a great moderator to try to draw out some of the questions and try to facilitate the discussion. But remember, today is, if you want to make a comment or make an argument on the Affordable Health Care Act, or what people like to call Obamacare, today is not that time. We're here to try to get questions and answers on what is about to happen January 2014. If somebody is here want to have that discussion, we can put that into another committee, and we'll be more than happy to have that. And that committee meets on the second Tuesday of next week. Well, without any further ado, we'd like to introduce Miss Melanie Stage.
Hello, everyone. Thank you very much for coming out today, and thank you so much to the council for the chance to be here and talk to you about the New York State of Health. We are the new marketplace that the state is setting up to help people, individuals, families, as well as small businesses, enroll in health insurance. As you'll learn, we're a way to help simplify enrollment for the public programs and help people get enrolled in those programs, as well as making it easier for people to buy private plans through the marketplace as well. So as you heard in the introductions, the Affordable Care Act, of course, is something that people are talking a lot about these days. A lot of the provisions do go into effect January 2014, but a lot of things have already been in effect starting since 2010 when the law passed. The marketplace is just one piece of the Affordable Care Act, so please do keep that in mind. There are things that you may have heard about the Affordable Care Act that I will not speak to today because it doesn't relate to, to the marketplace. But of course, we can ask those questions for our other panel experts as well. So with that, let's get started. See the next slide, please. So here's an overview of what I'll be talking about with you today. We'll describe what New York State of Health is. You'll also hear me call this just shorthand the marketplace. Up until August 20th, you may have heard people in New York State also refer to this as the exchange or the health benefit exchange or the healthcare exchange or the health exchange. What I'm talking about and what I'm calling the marketplace is that same thing. It's just after August 20th when we officially announced our name. Our branded name is New York State of Health, the official health plan marketplace. So my shorthand now is the marketplace and not the exchange. We'll also talk about the different sort of plans available through the marketplace, financial assistance that is newly available, set up by Congress through the Affordable Care Act, only available to people who purchase through the marketplace, as well as I'll give you a sneak peek at our awareness campaign that's going to kick off very soon. Next slide, please. So what is New York State of Health? As I alluded to, we are a new system the state's setting up. Again, we're going to help individuals, families, as well as small businesses enroll in health insurance. If people are eligible for a public program like, thank you, Medicaid or Child Health Plus, the marketplace will tell them and then help them enroll. If people are not eligible for those public programs, they can use the marketplace to purchase private plans that have been certified by the state, meet certain standards, and as I mentioned, the Affordable Care Act sets up new financial assistance that's available only to people who purchase a private plan through our marketplace. So essentially, we're making it easier for people to enroll and enroll in the right program for them based on what they're eligible for and what they can best afford based on their income level. So it's taking a very somewhat fragmented system that exists today and really making it simple for people to compare apples to apples and easily shop and enroll. Next slide, please. I mentioned that the Affordable Care Act was passed in 2010, and today is 2013. The marketplace launches on October 1st, 2013. So there's been a lot of things that have been happening since March 23rd, 2010, when the law was passed. One of the first things the state did when we started implementing the Affordable Care Act was we got a lot of grant funding from the federal government, the Department of Health and Human Services, to really do many things, including implement what used to be called the exchange, now the marketplace. One of the first things we did with that grant funding was work with consultants and contract with consultants to do a lot of policy studies to make sure we had great background research and information so we were making informed decisions. One of those first studies we did was with the Urban Institute. We wanted to use their very well-respected health insurance policy simulation model, and we asked them to model what the Affordable Care Act impact would be on New York State. One of those pieces includes how many people would they expect to enroll based on their model, how many people will use the marketplace and enroll in plans through the marketplace. And you can see here on the slide the results of that simulation. We expect at full implementation, 1.1 million New Yorkers will enroll through the marketplace. And you can see the breakdown here between the individual marketplace, that's individuals and families, as well as the breakdown for the small business marketplace, which is sometimes known as SHOP, which stands for the Small Business Health Options Program. Another point I'll make, when you see the 450,000 figure listed next to the small business marketplace, those refer to individual employees. That represents an estimated 100,000 small businesses that are expected to use the marketplace to offer coverage to their employees. Next slide, please. Thank you. Talking about the different enrollment dates. So as I mentioned, people can use the marketplace to apply for Medicaid and Child Health Plus, as well as private plans if they're an individual family, and the small businesses can use the marketplace to offer coverage to their employees. The enrollment periods differ based on which of those buckets people fall into. The whole thing kicks off on October 1st. That's when we launch. The first day that private coverage through the marketplace can begin is January 1st. Individuals will have a 6-month enrollment period, open enrollment period, for this first year. So similar to people who get coverage through their employer, you have a couple months to look at your different options and compare and contrast. People who enroll through the marketplace have that same option available to them. So even though we often hear the Affordable Care Act and the marketplace or the exchanges, you often see the date 2014 listed with those. The real date when we begin is actually in 2013, October 1st, when that open enrollment period begins, so people can compare options. And then 2014 is when the coverage would be effective. So again, initially, the Fed set up a 6-month open enrollment period because it's a new program. They wanted to make sure people were aware and had time to discuss all the options and really think it through. After that, it's a more traditional, almost a 2-month period, October 15th through December 7th. Individuals who use the marketplace to apply for Medicaid or Child Health Plus, they can enroll throughout the year. They're not limited to that open enrollment period. And small employers, of course, not every small employer has a plan year that begins on January 1st. So their plan year will end at different points throughout the year. They are not limited to that open enrollment period either. Small businesses can use the marketplace to purchase coverage for their employees for a plan effective date as the first of any month beginning or after January 1st, 2014. Another good caveat I should mention, an exception, there's an exception to every rule, including the 6-month open enrollment period, and then thereafter, the October to December open enrollment period. People who have a qualifying life event, such as a marriage, a birth or a divorce, or loss of employer-sponsored coverage, those qualifying life events will trigger what's called a special open enrollment period. So those people are not limited to that 6-month window or the 2-month window. They can apply at any point throughout the year if they experience one of those qualifying life events. Next slide, please. The central theme behind the marketplace concept is, again, making it easier and putting a system together. We're often compared to as the Expedia.com of health insurance, or a similar, airline comparison website. The concept is very similar in that, you would set up an account and then see what you're eligible for, and then be able to compare side by side the different options that are available to you based on where you live. Health insurance is based on, your region across the state. That doesn't mean that everyone is limited to the website, as we'll talk about a little later. There are also a phone line option, so people can call the call center if they want to talk through and don't want to use a website, that's fine. There are also different avenues people can use to get help in person, again, if they don't want to use the phone option or the online option. Next slide, please. Let's start out talking with that website option. So the online enrollment. When you see the word portal, it's just a fancy word for a website. Sometimes we use the word web portal interchangeably. So within that one portal or the one system, the one website, people will start out by putting out some information, such as like your name, your address, your income level, and then that information you submit will determine what you're eligible for. So unlike today, where people often don't apply for Medicaid unless they think they're eligible for it, because who wants to go through the hassle of applying for something and then find out you're not eligible for it? This really simplifies that process, because now the message is if you need health insurance, if you're uninsured, underinsured, you go to the marketplace, and the marketplace will tell you what you're eligible for and help you enroll in whatever works for you. So the marketplace will again tell you if you're eligible for a program like Medicaid, or if your kids are eligible for Child Health Plus. If you are, it will help you enroll. If not, you can use it again to purchase the private plans. So again, there's this concept you may have heard called no wrong door. It means that no matter what program you're eligible for, you start at the same place. There's one website, there's one call center phone number, there's one set of people who have been trained to help you, and whether or not you're eligible for a public program like Medicaid, or potentially to get those tax credits or the financial assistance to get the private plans, or just want to purchase a private plan without the assistance, doesn't matter. You don't have to know before you get there what you're eligible for. The system will tell you. Everyone's there to help you no matter what you're eligible for. Next slide, please. One of the other policy studies we did a lot. We did 15 of them. They're all on the website, which I'll tell you what the address is for that at the end of this presentation. One of the other policy studies we did was looking at small businesses throughout the state. We contracted with Wakely Consulting to survey small businesses and ask them, okay, what do you think the marketplace will really do for you? We wanted to see really what the benefit is to the small business owners who will be able to use the marketplace. And from that study, we received these 4 what we call our value propositions. So you can see these are the 4 things we really expect small businesses to be able to value about our marketplace. They liked the idea of having different choices for health plans and having all those available to them from one place. They liked the idea of having different contribution options, which we'll get to in the next slide. They liked the administrative simplicity of the marketplace as opposed to having to deal with multiple plans. And they also liked the idea of a tax credit that's available only through the marketplace for small businesses starting in 2014. On the next slide, we can talk about the different coverage options and contribution options I just referred to. You can see that we have two columns here. The coverage and contribution are laid out. But please know that these aren't dependent on each other. Number one doesn't match with number one. Number two doesn't match with two. The employer will choose what coverage option he or she wants to make available to their employees. So they could choose particular plans. When we see the letters QHP, it stands for Qualified Health Plan. It's just the different private plans that are available through the marketplace. They could choose a different category of those qualified health plans, which we'll talk about, called the metal tiers. Or they could really open up the whole marketplace to their employees and say, okay, you're able to choose from any plan that's available in our county, totally up to the employer. The contribution options, you can see there are three options laid out here. They can use an uncapped percentage, a capped percentage, or the defined dollar amount. Now, another thing we know from our research shows that 76% of the small business owners that were surveyed really liked the idea of this defined dollar amount because they thought it was a great way to help them predict costs going out and budget in the future. So the idea behind the defined contribution is, just as it sounds, the employer would say, okay, I'm going to give you X number of dollars a month. Choose your options. That's what I'm going to give you. If you want to buy something that costs more than that, you're responsible for the rest. Okay? Next slide, please. We'll talk about this administrative simplicity. Now, I just said that employers have the option of opening up the whole marketplace and saying, okay, choose whatever you want to. Now, in today's world, that might sound like a bit of a headache because small business owners might have to get multiple bills for multiple plans. The benefit of using the marketplace that we found through the survey is this concept of administrative simplicity. So the employers, regardless of how many plans their employees choose and how many different companies are going to be offering that coverage that they choose to enroll in, the employer will get one bill each month from the marketplace. They pay us. We remit the appropriate premiums to the plans. And the final, on the next slide, benefit of the value propositions is the small business healthcare tax credit. Now, there's a lot of words on this slide because the first bullet talks about this tax credit, the details that are available today. So Congress set this up through the Affordable Care Act. It's currently available to small businesses who meet this criteria. Starting in 2014, Congress said, okay, well, when the marketplaces are open, we're only going to make this tax credit available to small businesses that choose to enroll through the marketplace. So if someone is getting the tax credit today, a small business, the only way he or she can keep that tax credit is if they choose a plan through the marketplace. Also in 2014, you can see the tax credit will increase. The eligibility factors are here. The idea is that it's really meant to help the very small businesses. So as the number of employees and average salary increases, the credit will decrease. On the next slide, we'll flip over to our second venue for customer assistance, and we'll start talking about our call center. So again, we're often described as the online website or the online portal. Don't forget, if you're afraid of the website, don't like the internet, don't have internet access, that's fine. You can still contact the marketplace through in-person people we'll talk about later, as well as this call center. With those three different options that are available, people are not limited to only one option. They can choose any or all of those options. And when they go to the marketplace, they don't have to start and stop the process all at once. They can start it, check it out, save it, come back later. They could start online, decide to save it. Maybe they get stuck on something online, pick up the phone while they're still logged in, that's fine. Maybe someone wants to start with the call center, do the whole process in one shot, that's fine. If they have any questions, they can, of course, call the call center as well. Questions can range from, okay, I want to fill out my whole application now, help me do that. Or it might be something more basic like, how can I find someone in person in my community who can help me? The call center representatives will be able to answer those questions as well and point people to the correct spots in their community. On the next slide, you'll see that we have a range of language assistance available. Another policy study we did when we looked at the different numbers of people who will enroll through the marketplace, we of course wanted to know more about them, including demographics. So you can see, of course, New York's a very diverse state, especially downstate. Everyone doesn't speak one language. There are multiple ones. The assistance that's available through the marketplace is available in all these languages. If someone decides to go to someone in person and that organization doesn't speak the correct language, they're able to pick up the phone and get help through the call center as well. On the next slide, Speaking of those in-person assisters, we'll flip to our last venue of assistance. We're talking about a category called in-person assisters, which you'll see on the next slide. There are three main buckets for this. When we say in-person assisters, it's a fancy word the state came up with. These are all the people you can go to get help in person, as the name implies. First category is the IPAs, or the in-person assisters, or the navigators. These people have received, these organizations, I should say, have received grant funding from the state to help people apply in person. So you may be familiar with the Facilitated Enroller program that exists today. The state set this program up before the Affordable Care Act passed. It's a program to help people apply for public assistance, or public programs, I should say, like Medicaid or Child Health Plus, help them apply in person. So this is a very similar concept, except that it's not limited to just the public programs. Now with the Affordable Care Act, we have through the marketplace also the private plans that are available. So these in-person assisters and navigators, as well as the other categories on this page also, will be able to help people regardless of what program they're eligible for. So the IPA navigators, again, these are community-based organizations, receive grant funding from the state to help people apply. You can see at this link that's listed here on our website, which is nystateofhealth.my.gov. That's what we call our informational website. Today, if you go there, it will show you different sort of resources that are available to you, help you learn more about what's coming on October 1st. On October 1st, that's the same website you'll go to actually enroll. So that name won't, behind the scenes, some things may look different, but ultimately you only have to know that one website, making it easy. But if you go there today, like I said, you'll have different resources available to you to help you understand what's coming on October 1st. One of the resources that's, again, listed here, this map. There's a map of New York State that shows each county. If you click on a county name, you'll be able to see what organizations within that county have received grant funding to help people apply in person. You will not see on that map or on the website elsewhere any sort of information about where the actual locations are, as well as the hours that are available for in-person assistance. Starting October 1st, when you can actually go to those places to enroll, that information, of course, will be listed online. Next category is the insurance brokers and agents. Another thing we learned from our policy studies is that 88% of the small businesses in New York State who offer insurance today do so through the help of a broker or an agent. Of course, we wanted to build on that relationship, and so we have created a training program for brokers and agents. If they want to help people enroll in plans through the marketplace, they take the certification course. It's an 8-hour continuing education course. They take the course, pass the test, sign a contract with the marketplace. They're able to help people enroll in marketplace plans. And finally, we have our certified application counselors. It's very similar to the IPA Navigator program. It's not a grant-funded program, so they don't receive the funding from the state, but again, very intense training. Think of these like organizations such as hospitals or health plans who are currently doing some facilitated enroller work for the state. Same concept. Moral of the story is if someone needs help or wants help applying in person, there are a range of people who have been trained by the state who will help them do that. And all these people will be available through the Marketplace website. Excuse me. On our next slide, we'll start talking about the health plans that are available through the Marketplace. Next slide, please. So the plans that are offered through the Marketplace have all been certified. They essentially had to, in a sense, apply, basically. They put together their products following the rules that the Marketplace set out. They've been certified and reviewed in extensive detail by the state and have been approved to be available through the Marketplace. As you can see, the results of our health plan process, the certification process, there will be a choice of plans across the state. We also approved the Department of Financial Services, the state agency that currently regulates health insurance. They are regulating the prices for the plans through the Marketplace as well. The rates were released back in July that have been approved. And even before any financial assistance, that's also available through the Marketplace to help people purchase coverage. Just the fact that you're bringing so many more people together in the same rate pool, that brings the premiums down on average across the state 53% to today's premiums. So today, if someone wanted to purchase coverage, insurance coverage for themselves, and if they wanted to purchase that private coverage without having an offer of employer-sponsored coverage, they would contact the plan and purchase the plan directly. those premiums average over $1,000 a month today. Due to this and some other reforms as well within the Affordable Care Act, even without that financial assistance, you could see a benefit of using the marketplace as well. Another important reform that's included within the Affordable Care Act and applies to the marketplace plans says that, as of January 1st, 2014, no one can be denied coverage based on having a pre-existing condition or charge more for that pre-existing condition. That applies as well to the marketplace plans. On the next slide, we can see the plans that have been certified. When I say plan, I mean the insurance company, the actual products that are available through the marketplace. You'll be able to see that when you go to the marketplace. On the next slide, you'll also see the names of the plans of the qualified dental plans that are going to be available through the marketplace. The Affordable Care Act also says that standalone dental products will also be available to be purchased through the market. On the next slide, you'll see another concept from the Affordable Care Act called the Essential Health Benefits. So these apply to products, some products outside the marketplace as well, but we're talking about them now because they, of course, apply to plans in the marketplace. These are the 10 sets of categories of benefits that have to be covered by all plans in the marketplace. And the insurance companies can go above and beyond and offer some other benefits as well, but this is the core. These are the core ones. And you can see it really does offer comprehensive coverage because they really cover a wide range of services. Another important benefit of the Affordable Care Act, and that applies to the marketplace plans as well as others, is that preventive services will be offered at no cost to the enrollee. On the next slide, we'll introduce another concept called the metal tiers. So if I just said that most of the plans in the marketplace are going to look very similar because they have to all cover those same set of potential health benefits, well, then how are people going to compare among the plans that are offered? And that answer is, one of the answers is, they'll be sorted based on metal tier. This is another phrase from the Affordable Care Act. It's based on a concept in the insurance world called actuarial value, which is what essentially means is the average amount that the insurance company plan will pay versus the amount that the enrollee will pay. So for example, if you have an actuarial value of 60%, it means that on average, the plan will cover 60% of the cost of care, and the enrollee will cover 40%. So you can see that there are 4 different metal tiers laid out through the Affordable Care Act, the way that the plans in the marketplace are classified. Bronze is that 60% actuarial value, and then it goes up to platinum, which is 90%. So if the plan's going to cover 90% on average of the costs of the enrollee's care throughout that pool, that means that at a platinum level, the premiums are going to be higher, and what the enrollee will pay through cost sharing, like copays or co-insurance, the things that add up to your deductible, that's going to be lower. So the way that people would compare plans in the marketplace, in addition to looking at those benefits, because they can be a little bit different, is really a basic decision of whether someone wants to pay more premium each month and lower cost sharing, or if someone wants to pay lower premium and higher cost sharing. And that, of course, is a decision that the enrollee can make based on other factors that they consider important, and also the estimated amount of care that they expect to use each month. That helps shape their financial decision as well. On the next slide, we'll get into what I've referred to a couple times now as our financial assistance. So the Affordable Care Act creates 2 new forms of financial assistance available to people who purchase private plans through the marketplace. So these are, again, only available to people who purchase through the marketplace. The first is a premium tax credit that will go, as the name implies, towards the premium. Both of these financial assistance forms are based on the people's income. It's set by what's called the federal poverty level. For the premium tax credit, it's up to people with a 400% federal poverty level income, which in real dollars, you can see the breakdown here in the bullet. For an individual, it's $45,960. For a family of 4, it's $94,200. The cost sharing reductions help reduce the cost of that cost sharing we talked about, like the copays, co-insurance. That's for people up to 250% federal poverty level, and you have to enroll in that silver level plan, one plan offered at that silver level tier. And you can see here the breakdown for the individuals and family of 4 for those, $28,725 for an individual, and for a family of 4, $58,875. The premium tax credit, you have a choice if you want to, you have 3 options. People could either take it now, take it later, or split it. That basically means if they want to see it applied to the premium each month they pay,